We're going to begin with new COVID concerns. Frontline workers around the country are sounding the alarm about the Delta variant as more and more people test positive. Every state except South Dakota and Wyoming have reported an increase in new COVID cases.
In fact, George, the average number of new cases nationwide per day now is up nearly 160% in just the past 4 weeks. Steve Osunsami is live outside CDC headquarters there in Atlanta with more. Good morning, Steve.
Good morning to you, Robin. More than 161 million Americans are now fully vaccinated against the coronavirus. And authorities here at the CDC would like Americans who are holding out to know that they are the ones getting sick. The director of the CDC is calling this the pandemic of the unvaccinated.
Healthcare workers in the nation's hospitals are concerned this morning by the new numbers of COVID cases they're seeing again, most likely caused by the Delta variant of the coronavirus. In Oklahoma, the average number of hospital admissions for COVID-19 has nearly tripled in the last month.
We're basically full now. We hadn't seen that since the height of the pandemic in January and February.
Every state but South Dakota and Wyoming is reporting a rise in new cases. Nearly 19,000 people are currently hospitalized nationwide, about 26% more this week than last week. That's still, of course, much better than the all-time high of 125,000 COVID-19 hospitalizations that the country reached in January. But authorities worry that the numbers are moving in the wrong direction.
This new Delta variant is transmitting very quickly. People are getting very sick. And there's not a whole lot we can do when you come in and you're already in a very, very severe stage of the disease.
In Los Angeles, they're back to old rules. Over the weekend, health officials began requiring everyone to wear masks at indoor public places again, even if you're fully vaccinated.
In areas where there are low numbers of vaccinated people or where cases are rising, it's very reasonable for counties to take more mitigation measures.
Scientists say that the current vaccines are highly effective at preventing hospitalization, but that no vaccine is 100% effective. So there are rare cases where fully vaccinated people have been hospitalized.
They'll have trouble breathing, their lungs will be affected, and they might need extra oxygen, but the total numbers of those will be limited much more than they were if you weren't vaccinated.
And then there's the story of Adam Joseph and his children.
We kind of feel like we failed as parents.
He's a meteorologist at our station WPVI in Philadelphia and says he thought he took all the necessary precautions when he invited an unvaccinated family member to his home. But that person tested positive, and now his children, who were too young to get the shot, are sick with COVID-19, and so is their nanny.
Please, if you are not vaccinated, do not go around children who are under 12. They are so vulnerable right now.
Most of the outbreaks are happening in states with low vaccination rates, but authorities here point out that there is one bright spot, that in those same states, they're seeing a slight increase in the number of people who are newly vaccinated, who are hearing word of these new infections and new hospitalizations. George?
Bit of encouraging news there. Okay, Steve, thanks very much. Let's bring in our friend Dr. Ashish Jha, Dean of the Brown University School of Public Health. Welcome back. So the evidence is getting more clear by the day. If you're not vaccinated, you've got a very good chance of getting the Delta variant and getting very sick.
Yeah, good morning, George. That's right. The evidence is that this virus is going to be with us for a long time. It's going to become endemic. So everybody is either going to end up at some point getting vaccinated or they're going to end up getting infected. People really have to be very careful out there if you're unvaccinated. And the best way to protect yourself is to get the shot.
What do you make of these reports we're seeing of vaccinated people contracting the virus again?
Yeah, this is the most contagious version of the virus we have seen throughout the whole pandemic. It's really very, very contagious. And so if you have significant exposure, you are going to see some breakthrough infections, even for vaccinated people. The good news is those people are not getting particularly sick. Obviously, very, very few people who are vaccinated end up hospitalized or dying. That's what's really useful here. But no vaccine is perfectly 100% effective.
Define significant exposure.
You know, it's interesting, right? In the old days, we said, okay, 15 minutes, 6 feet, you really have to be very, very close to somebody for a long period of time. What we're learning with the Delta variant is that is not necessarily the case. There's so much more virus around. People who are infected have such high viral loads that even short periods of time, 5 minutes, 7 minutes, you don't even have to be within 6 feet. For people who are unvaccinated, they are getting infected with much, much shorter exposure.
Schools will be opening across the country in the coming days and weeks. Should the CDC consider changing their guidance about kids saying they don't need to wear masks in schools?
Yeah, it's a really good question. First and foremost, I think we have evidence that we can get kids back to school safely, even in the context of the Delta variant, even kids under 12 who are not vaccinated. So I think kids should be back, and we can do that safely. I do believe in areas of high levels of outbreaks, it makes sense to have kids who are not vaccinated be wearing a mask. For I think kids who are vaccinated, adults who are vaccinated, it's much more reasonable to skip the mask. But the key issue is unvaccinated kids, certainly unvaccinated adults, should be wearing a mask in places with large outbreaks.
CDC advisory panel is going to meet this week on booster shots. What's your current thinking about whether they're going to be necessary?
Yeah, my current thinking based on some recent data out of Israel is that I could imagine some high-risk people in nursing homes, people who are immunocompromised, needing that extra level of protection. I have to tell you, a couple of months ago, I didn't necessarily think that was going to be the case, but the data is evolving on this. But for most of us, I don't think we're going to need a booster, certainly not anytime soon.
Dr. Jha, thanks for your time and information.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.